we are going to discuss about the meningitis today. Meningitis is the inflammation of the meninges of brain and spinal cord. But if we go to the definition, meningitis is the inflammation of the arachnoid and pia mater of the brain and spinal cord. Meninges, you can see this diagram. First layer of first is cranium of the skull. It's the first layer of the skull which cover brain, cranium, then dura mater. It is the first meninges of the brain, and second is arachnoid, and uh, after this there is a space that called subarachnoid space, and after that last meninges is pia mater. So inside of subarachnoid space, which is situated between arachnoid and pia mater, CSF fluid is circulate. When the meningitis occur, the arachnoid and pia mater become inflamed, and the swelling cause swelling in the subarachnoid space. Because of it, the circulation will be decreased and CSF can be infected. It is also called CSF, cerebrospinal fluid infection. Now we want to discuss about etiology. First, it is caused by meningitis, bacterial meningitis. Bacterial meningitis is caused by Neisseria meningitis. Haemophilus influenza. And Streptococcus pneumoniae. Bacterial meningitis is the most severe form in meningitis. Then viral meningitis. It is less severe, but it is most commonly occur uh, examples are herpes simplex virus, and second one is enterovirus, which is the most common in viral meningitis. It can be treated in within 2 weeks without any medication if physician can prescribe acyclovir, which can be beneficial. It is an antibiotic. The third is fungal meningitis. Which is caused by histoplasma. Now we going to discuss about the clinical manifestation, any sign and symptoms. Specific symptoms are photophobia, means fear of light, means when the patient who having meningitis feel irritating from the light. Second is neck stiffness, which called neutral rigidity. Then non-specific, like nausea, vomiting. Lethargy, loss of energy or enthusiasm. Fatigue, fever, severe headache are the symptoms of meningitis. Then we talk about the diagnosis. Diagnosis are CT scan, MRI, uh, and CSF culture, CSF examination, blood culture. You can CSF examination means CSF analysis, and then blood culture are the basic diagnosis for meningitis. Then treatment. Normally, in bacterial meningitis, cephalosporin can be prescribed by the physician, but sometimes in viral meningitis, which is not so much dangerous, so we can in viral meningitis में we can call acyclovir. So that's it for tomorrow, for today.